The federal government says that Nigeria is not ready for a full reopening of the economy. Mr. Boss Mustafa, Secretary to the Government of the Federation, SGF, and Chairman, Presidential Task Force on COVID-19, said this at the 63rd Joint National Briefing of the Task Force held at the International Wing of the Nnamdi Azikiwe International Airport, Abuja. The SGF said that the PTF believes that while Nigeria was not ready for a full reopening of the economy, there have been sufficient progress to warrant significant further relaxation of the restrictions applied. And speaking on global efforts on vaccine, he said that the global community have made appreciable progress in the development of COVID-19 vaccine, and that as at August 28, a total of 173 candidate vaccines were under evaluation.
Based on the foregoing, the Presidential Task Force today submitted its 7th interim report to Mr. President for his consideration and approval. The main thrust of the recommendation is that Nigeria advances to the 3rd phase of eased restrictions with further amendments to address economic, socio-political, and health concerns. This will last till a time when the pandemic is sufficiently controlled in our country. The countries today that top the global disease burden include the United States of America with 6,257,938. Brazil with 3.952 million. India with 3.769 million, and Russia with over 1 million. South Africa still has the highest case count in Africa, but has fallen from the 5th to the 6th position in the world. In Ethiopia, the numbers have been on the increase. Both South Africa and Ethiopia are of interest to Nigeria in view of the passenger traffic between Nigeria and the two countries, and our plans to reopen the international airspace calls that to question. The Presidential Task Force would continue to monitor developments so that the country can benefit from the emergence of an effective vaccine. The Presidential Task Force is particularly disturbed by the low level of sample collection because of what it portends for the strategy of testing, detection, tracing, isolation, and treatment. Let me give you an example. In the month of July, 7 states reported lower numbers of samples collected than in the preceding month. But in the month of August, this number rose from 7 to 32 states that reported lower collected samples than the preceding months. This illustrates that despite the increased diagnostic capacity and improved access to testing, the demand remains low, with not enough samples being collected. Therefore, the recent reduction in cases in some states could be attributable or attributed to the low testing